Cervical cancer rates in the U.S. are overall declining, but a study from UCLA shows that advanced stage cervical cancer is increasing, about a 1.3% increase a year. Joining us right now to give us some insight on this is board-certified gynecologist Shaga DeNoble. Good morning.
Good morning. Thank you for having me.
Yeah, a really important topic. And the first question I have for you is, why are we seeing the increase in this advanced stage cervical cancer?
You know, that's a great question, and it's very disturbing that we're seeing an increase, especially since rates were going down with better screening technologies that we use, including HPV testing, as well as vaccination for the HPV virus.
Yeah, and are we seeing these numbers maybe increase? And if so, is there a certain demographic of women that we're seeing the increase in?
Yes, we are seeing an increase in the past 2 decades, which is very disturbing. And this looked at data up to 2018. So it's not taking into account the pandemic and patients possibly not going to the doctor as often in the past couple of years, which is also a little bit worrisome. We are seeing an increase in advanced stage, which means stage 4 cervical cancers, and especially in Black women, but also the rate has been increasing in white women in the South.
And is there something that can be done, but more importantly, what should women be looking out for? I mean, we know that these appointments, they can go kind of, they can be not put on the priority list, very high on the priority list. So what would you suggest for us?
Yes, that's a great point. You know, I think sometimes women might feel fine, not have any symptoms, and not realize that they still need to see the gynecologist every year.
Yeah.
One of the confusing things is that the guidelines for screening for cervical cancer with a Pap test have increased the time frame that you can go for testing every 3 to 5 years. However, that is in average risk patients, and that does not mean you don't need to see your gynecologist every year. And I think that's where patients sometimes get confused. Also, when the frequency of Pap testing is spaced out a bit, it's hard to remember when was my last Pap smear.
Yeah.
And you might not be getting a phone call, and you might forget, and you might be very overdue for your Pap test.
Absolutely.
But things you can look out for: abnormal bleeding, bleeding after intercourse, pelvic pain, change in your urinary symptoms. All of these things should make you go to the doctor and get examined.
Yeah, and we are also unfortunately seeing an increase in uterine cancer. Why is that?
We are. That's another cancer, especially the type 2 uterine cancers, which are not estrogen dependent. Endometrial cancer is the most common uterine cancer, and it's very common in this country, but the rates are also increasing there. We don't know exactly why they're increasing, but we do know that there is a much greater increase in the African American population. A lot of factors could play in. We know that race is signifies economic and also other social factors and environmental factors. Yeah. But we're seeing an increase there, and it's a large racial disparity for Black women, which is very disturbing as well.
Well, some really important information. Where can people go if they have maybe some more questions or just want a resource to go, kind of look at things?
Well, looking online at the CDC website has some great information, but definitely you should see your gynecologist if you have any new symptoms: abnormal bleeding, spotting in between periods, heavier periods. That should not be ignored, and you should definitely see your gynecologist.
All right. Thank you, doctor. We appreciate you taking the time.
Thank you.